guys, this is Dr. Barnes with Veritas Nursing Academy in Tampa, Florida, and today we're going to be discussing two separate but sort of the same courses. One is the Agency for Persons with Disabilities, or what's known as APD, their basic medication administration course, and the other is the Florida Department of Elder Affairs, their medication technician course. Now the difference between the two is students who will be working with APD will typically work in a group home setting with clients who have intellectual or some kind of disability. And people who, or students who will be working with the Florida Department of Elder Affairs will be working in assisted living facilities, assisting patients with their medications. So let's look at one of the very first things. There are different routes of medication management in this program. So the three routes are going to be administration of medications, self-administration of medications, and assistance with self-administration of medications. So the very first one, administration of medications, means that the person would actually give the patient their meds. That means placing the medications into their mouth, okay? And with this type of route, we would be looking at usually an RN or an LPN delivering those meds. But in this case, APD has gotten approval with the state of Florida to allow students like yourselves who may not have a nursing license to actually learn how to administer medications. And with the Florida Department of Elder Affairs, their med techs who work in assisted living facilities cannot administer medications. So throughout this course, when I use the term administration, I'm specifically discussing people who work for APD in group homes. When I say observation or assistance, I'm specifically talking about people who work with the Florida Department of Elder Affairs in an assisted living facility as a medication technician. Those are the two different types of students I'm discussing. So at this point, with the assistance with self-administration of medication, that means that we're going to assist the patient to take their own meds. So that means that we might have to crack the bottle open for them. We might have to place the medication into a cup. We might have to put the cup into their hand and even help them to push it up to their mouth. But what we do not do in this particular case is we do not put the pills directly in the mouth. So again, APD or the med techs, okay, in this particular case, when you're assisting, you're allowing the patient to do as much as they possibly can in taking this medication. Now, if you're looking at self-administration of medications, that's where the patient does it on their own. You don't need to help them. That means they can do everything from opening the bottle, removing the medication, and taking it themselves. It also might mean, depending on the facility and the circumstances surrounding the patient or the client, that they might keep their own meds in their own room. So that again is going to be up to what's going on with the patient, the facility policy, any kind of Florida statutes or rules, and then the type of facility that you're working in. So if you're working in an assisted living facility, they may allow this. Their policy may also not allow it. So you'll need to know that. The next thing that we're going to discuss is MORs and MARs. So what is a MOR? A MOR is a medication observation record. So an MOR is a medication observation record. And what that is that is for the students who are going to be working with the Florida Department of Elder Affairs as a med tech in an assisted living facility. They will use that type of documentation. And that means that they're going to assist with the meds. So that means that the patient does a majority of the work, but they can help them by placing it in the hand and also go as far as taking their hand, placing it up underneath theirs, and pushing it up to the client's mouth. Okay, so that is the assistance portion of it. So some way, some form, that patient is going to help you. If it's ear drops, the patient is pulling up and back on their own ear. If it is eye drops, the patient is pulling down and looking up on their eyes. If it is nose drops, the patient is pushing up and leaning their head back for the nose. So they're doing something to help you, okay? With a MAR means medication administration record. And again, when we talk about administration, that is specifically in this course being talked to for the students who are working with APD. So they are working in the group homes with clients who have disabilities. And with administration, remember that they are allowed to directly place clients' pills into their mouth, okay? So a MOR or a MAR are basically the same exact tools, with the middle word being a little different. So MAR versus MOR. But in general, when we look at this book, it's the same thing. So it will have the name of the client, it'll have the month and the year that we're currently in, it'll have a listing of all their medications and the very specific directions on how to give it or assist with it. It will have the times that you would help the patient with their medications, and then going across this sheet, number 1 through 31 are the days of the month. So as you assist or administer the patient's medications, you're going to put your initials in this, okay? So also at the bottom of every MAR or more, there is a section for you to not only print and sign, but also to initial. And the reason why we have that is because if I constantly see LB, LB, LB written across this MAR or more, I want to know who LB is. And the way that I can find out is by looking at the bottom and saying the initials belong to this person. On the back of every MOR or MAR, there's an area for any kind of med errors, or if you had to hold a medication, or if you gave a PRN medication. And so while we're on this topic real quick, a couple of things. If a patient ever refuses a medication, you must ask him 3 times. So go back, if your time frames are 1 hour before up to 1 hour after the medication is due, which is the general rule of thumb, if you have a medication that's due at 9, and you start at 8 and the patient refuses, you go back at 9, you ask a second time if they refuse, and then the third time would be at 10. If the patient refuses all 3 times, you need to mark the correct box and the correct time for the refusal, and then on the back of the sheet you would put the refusal, why they refused, and who did you call and what did they say to do. That is a critical piece, because if this patient doesn't get the medication, could something bad happen to them? And so that's the reason why it's important for us to follow up. If the patient is being given a PRN medication, remember PRN means as needed. You only take it if you need it. You'll notice that on any kind of MAR or more, PRN medications typically have their own page. They're usually not mixed together with the regularly scheduled meds. And on top of that, they will not have a time listed. It'll give parameters, which you will follow the directions of the parameters, but it will not give specific times, like give it 1, give it 2. It'll be open because it's an as-needed medication. You give it when you need it. Now remember one thing, that as with regularly scheduled medications, we can give the medication 1 hour ahead up to 1 hour after. So if it's due at 9, you could give it as early as 8 or as late as 10. With PRN medications, that is not allowed. If it says every 4 hours, you must give it on the dot every 4 hours if the patient requests it, okay? And on top of that, the patient really needs to come to you to request it. Now, once you sign off, let's say a patient gets a PRN med at 9 a.m., then you're gonna sign off at 9 a.m., and if it says the parameters are every 4 hours, they cannot get that medication until 1 p.m. Then on the back of your med sheet, not only are you documenting that you gave that medication or assisted with that medication, but you also must follow up. So I always tell students a good rule of thumb is a half hour after you give the medication, check and see how they're doing, and then an hour after the medication has been given, also check and see how they're doing. That way you're kind of keeping up. Is the medication working? In the end, did it really take care of the problem that they were having? And if it doesn't, guess what you need to do? You have to discuss it with the practitioner. So that is going to be the MARS or the MORS. So this is our record keeping system. Remember that at the end of the month, these will be removed. New sheets will go in, and it's very important that every single month per page that you write your name, sign your name, and put your initials. That way we have it on there, okay? And we never ever throw client documentation away. It gets placed into the client's permanent records. That way, if anything were to happen and an investigation were to occur, we can go back and look at these sheets and see what was happening during that time frame. So that's a very critical piece of information for you. The next thing that we're going to look at is going to be the narcotic or the controlled substance book. Now, remember with narcotics, these are heavily monitored, guys. First of all, anytime you give a controlled substance, it must always be accounted for. That means as soon as you give the med, you need to document who you gave it to, how much you gave, what's left, so on and so forth, okay? And so also with this type of documentation is gonna be the shift change. So every single shift change, you must do a count, okay? And so on this particular form, this is by APD, but most of them generally look the same. It will have the name of the drug, who the drug belongs to, how much did you actually get when it first came in, what date did it come in, who saw you bring it in. So you have to have like your witnesses. So if someone brought in Xanax, 1 milligram, and there were 100 tablets, then I need myself and my witness to sign off saying, yes, that's what came in. Now, every time we give the drug, again, date and time, the name of the patient, the number on hand that we currently have. So if I had 10 in the bottle, I gave 1, I've got 9 left. And then I sign it, okay? And at the end of the shift, when the shift is coming on, whoever comes on does the count, okay? Not the person leaving, because the person leaving could have been pocketing meds. So we always make sure that we do a count, number 1. Don't ever take someone's word that nothing was used, or the bottle's taped up so it didn't get used, or it's been sealed. No, it's your responsibility to do that narcotic count. And on top of that, for my people